Dad, sometimes I feel my heart suddenly racing for no reason, like it skips or flutters. Is that normal, or should I be worried?
Well, actually, Lara, that's one of the most common reasons why people come and see me. The feeling of their heart fluttering, skipping, or going quite fast. But what I'd say is that 99% of the time, it's not dangerous, it's nothing to worry about, but it's also equally something that you shouldn't ignore. It may be the heart's way of signaling that there's something not quite right.
So, what is actually happening in your heart when that happens?
Well, your heart beats in its own steady and organised way, controlled by its electrical system. And there's a little area on the top of your heart called the pacemaker, which fires off a signal that spreads throughout the heart in an organised and particular pattern. That causes the heart to beat in a steady and organised pace. And what people call palpitations is when they become more aware of their heart. They can feel it racing, pounding, fluttering, or even like a skipped beat. And sometimes because the heart is genuinely beating faster than normal, or it can be due to an extra beat coming from somewhere else within the heart. Or it actually can feel something that's gone very irregular, in an irregular pattern, not like the steady pace that the normal heart is used to beating in. And all those can feel quite similar from the inside, but in reality, those can actually mean different things that the heart is doing.
And is it usually something serious, or is it normally fine?
No, Lara. Well, as I mentioned, 99% of the time, those palpitations are benign. The heart can be very sensitive to external triggers, things like caffeine, stress, alcohol, lack of sleep. For women, also particularly around hormonal changes around their cycle, pregnancy, or menopause. All of these things can cause short bursts of palpitations, and again, 99% of the time, they're benign and nothing to worry about.
So, when does it actually become something to worry about?
Well, actually, Lara, there are a couple of patterns that we do want to know about. I suppose the most common one is atrial fibrillation. That's when the top of the heart chambers, rather than beating in its normal, steady, regular pattern, are now beating in an irregular, chaotic pattern. And patients can feel atrial fibrillation either as a fast, irregular heartbeat, or they can feel that their heart's gone into an irregular pattern. Actually, a lot of patients don't even feel it at all. The problem with atrial fibrillation is that it itself is a benign rhythm. It's not going to make your heart get any worse, or it's not going to have a long-term problem for yourself. The only problem with atrial fibrillation is that it increases your risk of stroke. And that's why we want to know about it, so we can mitigate that risk. And we usually mitigate that risk by putting patients on blood thinners. We don't put everyone on blood thinners. We have a particular risk score that decides, are you at more risk of having a stroke because of atrial fibrillation? Something called the CHADS-VASc score. And we use that to decide who should have their blood thinned. And the second pattern, which is of interest, is something called an supraventricular tachycardia, or an SVT. That's when the heart suddenly jumps into a quite fast and regular heart rhythm, often up to 150, 180, or even a bit more beats per minute. And that can just suddenly start and equally suddenly stop, just like that, out of nowhere. And the important thing about SVTs, again, the vast majority are not dangerous and can be easily treated, either with some medications or even an operation called an ablation. And what I would say is probably the most common reason why people come and see me for palpitations is due to ectopic heartbeats. These are heartbeats or extra heartbeats arising from not the traditional part of the heart, the pacemaker, but from other parts of the muscle. And they can feel like a skipped or an extra heartbeat. But the most important part of that is that it's, again, benign, and we can manage it based on the quality of life impact that it's having and on the frequency that you're experiencing it. We can either do nothing, or you control your lifestyle factors by reducing things like alcohol and caffeine, or if that doesn't work, we can give some medication to suppress those.
So, how do you actually figure out which one it is, especially if it just happens randomly?
Yeah, Lara, I suppose that's the challenge. Was the most crucial part to try and figure out what type of irregular heart rhythm or heart beat you're having is to do an ECG at the time that you're having it. And of course, you can't have someone like me around with you all the time to do a quick ECG. So most commonly, what we'll first do is do a baseline ECG when we see to see if there are any particular signs that can give an idea of what may be happening. But moreover, they're always normal. What we then do is get a more protracted ECG monitoring on you, where we put a patch on your chest and we'll make you wear it for anywhere between 1 full day. But more commonly, we try and get as much data as possible, anywhere between 3 days to 7 days of ECG monitoring. And what we're hoping for is actually during those 7 days for you to have one of those palpitations, so that we can then go look at the trace and at the exact time that you had the symptom and see what's going on. In addition to the ECG monitoring, and next most important test is to do an ultrasound of the heart or an echocardiogram and looking at the heart structure. If the heart structure is normal, that puts most patients who are having palpitations in a completely safe place. So palpitations in the context of a structurally normal heart offers a very good prognosis. And hopefully, once we've captured what heart rhythm you're having, we can decide a management plan for that and what we're going to do about it. Again, to stress, most heart palpitations are benign, and therefore we decide what to do based on your frequency of symptoms. Management plans can range from do nothing, take a tablet when you have palpitations, take a tablet regularly to stop the palpitations, all the way to having an operation called an ablation. But it's important to have a discussion with the patient to decide what's the right treatment for them.
So if someone's been getting this and just ignoring it, what would you say to them?
I'd say it's worthwhile getting checked out, because most of the time it's not serious, but we can give you an answer of what's going on, and if we do catch something, we can get on top of it early.